Hello, beautiful people. Something I wanted to speak about was the increased numbers of STDs in the older population. Now, working in the health field, I can say that STDs and HIV, it has no age limit and no age minimum. The youngest person that I have seen with HIV was 17 years old. So it's important, no matter your age, to be aware and to protect yourself. However, this video is about the increased numbers of STDs and STD rates in the elderly and older population, specifically 50 and over. Now, also in my field, I do see a lot of patients with STDs and new infections over the age of 50. Now, this may be for a number of reasons. There's a lot of down low activity going on. So you have husbands out here stepping out on their wives. You have the Viagra situation going on. And you have a lot of people in nursing facilities or older communities that are just living their life and don't think that that's something that they have to address or even be concerned about because they're older. Some of them may not even care because they are older. They're just probably thinking about the time that they have left and just wanting to enjoy it. And, a lot of people just think at that age that they don't even have a whole lot to worry about. They don't think that other people that age would have anything as far as a STD or anything to be concerned about. However, some of these things are curable, but a lot of them are not, and they affect the older community just as much, if not worse, because you are at a greater risk because you have a weakened immune system. So if you're an older person and you already have a weakened immune system, getting an STD that might otherwise be, not a huge issue and curable could, cause you a whole lot more issues. So if you're a younger person out here and you're messing with a sugar mama or sugar daddy, don't take it for granted their age, thinking that they're safe and it's not something you have to worry about. Because like I said, the youngest I've seen is 17, and then, the STD rates are rising with the older population. So it is something that every age bracket needs to be extremely concerned about, getting tested, having these conversations with your partners, and going from there. Now, something a lot of people don't know is that the herpes virus is extremely common. Over 90% of the population has it, and if they don't, they will at some point before they leave this earth. They do not test for the herpes virus in a standard STD panel because it is assumed that almost all of the population already has this. So there's type 1 and there's type 2. Type 1 typically affects the oral cavity, and type 2 typically affects the genital area. However, they are interchangeable. You can have type 1 in the genitals and you can have type 2 in the oral area. It is very easy to pass along with kisses, skin to skin contact, and there are different types of herpes. You can get it on your hands and, of course, on your lips via kissing. And this is how a lot of children get the herpes virus or cold sores as children, by being kissed by adults, by their parents, aunts, uncles, granny. And, people don't think it's a big deal, but you have to be careful with these children and young babies as well. And yeah, so that's just something I wanted to bring some attention to. The older population, and with everything that's going on, bringing some light to the STD rates in older people and some of the reasons why we're seeing this, and hopefully we can kind of curve this going forward. But thank you all for listening and be blessed.